Okay, well, let me call the meeting to order. What's today? November the 18th? December.
December 16th.
December.
I'm slightly behind schedule then. December is today the 16th?
Yes.
Yes, December 16th.
9 days to Christmas.
Woo!
Don't say that.
Okay, well, let me call the meeting to order then. Thank you all for clarifying with them. And I need you all, if you all could please review and approve the minutes for November the 18th, 2020. You should have received them several days ago. If there are any changes, revisions that we need to make, please let us know.
Sir, I have a question in regards to looking over the notes from our last meeting. I
Okay.
noticed that under guest, it's stated Richard Chamberlain, City of Laredo Health Department. Just a matter of record, is he technically our guest? Because I remember Dr. Gonzalez would more times than not, the majority of the time he was always with us. I don't know that we considered him a guest. So I guess my question is, will Mr. Chamberlain be attending as much as Dr. Gonzalez did, or is he considered a guest who comes by only sometimes?
He is considered the liaison for the committee, so he should be in attendance. Of course, right now with COVID-related matters, he is tied up in a WebEx that conflicts with this one. But I know he makes every effort to attend. So.
All right.
Mm-hmm.
Thank you.
So did we clarify whether he's a guest or not?
Sir, Miss Erica explained that he is considered the liaison. So he's going to be in attendance as much as he can.
Okay.
Because of COVID. He has other things, many hands on the fire, I guess, right now.
No, and that's fine. I understand. We all understand that his schedule probably gets very complicated.
That can be removed, and the members can approve the minutes with that change as amended.
Attendance. Okay, so we'll just make that change to the agenda, indicating that he was not a guest. Okay, that typically he would be in attendance.
So what we can do is change to report by city liaison Richard Chamberlain, City of Laredo Health Department Director.
Okay.
Thank you.
Eric, I just wanted to let you know that last meeting that we had, we spoke extensively of the locations where you could get a COVID test. And so I needed to get one of my kids checked out. And so I had it done there at the health clinic. And she came back negative, thank God, because she had been hanging out with somebody whose grandmother had COVID, was diagnosed with COVID. And so thank God that she came back negative. But I just wanted to let you know that I was, when I did finally find the location there at the health department, it's in the back parking lot.
Mm-hmm.
But the results came back within like 2 or 3 days, I think. And so I just wanted to let you know that I was very I was very appreciative that you had shared that information with us the last meeting, because it came in personally very helpful to me and my family. So thank you.
That's great to hear. I hope it was as painless as it could be experience. I know it's a little uncomfortable. Here at the clinic, we continue to do the nasal swabs. And then, of course, we have the partnership with Curative that does oral swabs in the different parks. We are expanding that type of testing in locations. That was pushed back a little bit. It'll hopefully be in place after Christmas.
Yeah, because I had done another one where they actually like take blood from you. I think that's an antibody or antibody test or something like that, where they do a blood test. If there are no further changes to the minutes for the last meeting, can somebody move to approve? Or motion to approve?
I'll approve the minutes.
And I'll second.
Okay, thank you, both of you. The next item we have is public comments. I guess I made my public comment already. Anyway, we have anyone sign up for public comment or?
Mr. Chair, we do not. We have recently made a change to the agendas. The agendas do have both the meeting link and the password, which means they can connect directly through WebEx and be participants of our meeting. We do not see anyone connected wanting to do a public comment at this time.
Okay, thank you.
Is it only me, but I'm having trouble hearing you, Erica? Or is that only me?
You.
Okay. All right, we're good then.
Do I sound far away? Am I a robot? What?
No. Erica, you sound a little bit softer than normal. She's right. We can still hear you, but your volume is a little bit less.
Maybe it's your volume. I mean, I'm loud. I know I don't even need this microphone, I don't think.
Let me see if I could adjust something. Switch audio, maybe? I'm using the computer. Okay, I'll keep working on it on my end.
Okay, good. Next agenda items, discussion possible actions on the following. It's a report from Christine Reyes, Special Needs Program. So welcome, Ms. Reyes.
Good morning.
Morning, how are you today?
Good. I dress warmly in the morning, and towards the afternoon it gets hot, and it's it gets a little up and down on the weather here, but I'm good. Thankfully, I'm good. I wanted to report on from our last meeting to now, our program has put up information via social media. On December 3rd, I believe Ms. Martinez sent and shared a video that was posted on our Facebook on National Disability Day. Thank you, Erica, for that. Our program made efforts to create awareness on National Disability Day. We asked the community support groups to share it as well, and the social media traffic on that video was great. We had a lot of views, we had a lot of people engagements and reactions. The video that was posted via social media was in regards to educating the community on National Disability Day and how they could observe it. The program also provided 2 additional flyers on tips if a child or young adult is faced with a sensory overload. This holiday season, I know with the lights, maybe even fireworks during New Year's, things like that, that create sensory overloads for individuals with developmental disabilities. We wanted just to put out some information and tips for caregivers and the families on how they can assist the individual with, for example, to calm the child or the young adult with noise canceling headphones, hearing ambient sounds, having a sleeping eye mask on to help with the lighting. So it was just in reference to help them with the sensory overload during the holiday festivities. I believe after Christmas, we're going to be reposting an additional sensory overload for the New Year so that it's shared not only prior to Christmas, but for the New Year celebration. Let me see. I believe we also did a flyer for self-care and mental health tips. This month, we've been very active with suicide prevention. So I also wanted to share with our demographics that, children and young adults do go through mental health issues as well. So we put in tips that they could do at home to keep busy, to avoid anxiety, depression. These tips basically express to the parents to have the child be active at home with new hobbies, introducing them to reading, journal writing, also creating a communication, a relationship with more communication. So that flyer went out as well and got a lot of social media traffic. We just are trying to encourage parents at home to establish a routine and to help them during common parenting challenges at home. Other than the videos and the education, we're on a project for the program for therapeutic gardening. This past month, I was faced with a little challenge on this project because I know Ms. Oda is out now, but really our goal for this project was for both of us to work on the therapeutic garden. And now that she's out, I was like, oh my goodness, I need more hands, I need more help. So I came across a veterans group during the month of November during Veterans Awareness Day. And this group was talking to me about getting into projects like therapeutic gardening, and it just clicked. So Mr. Chamberlain and our Miss Erica, they went through a project review that we sent in this past week, and thankfully it was approved. And so we're working garden so that we can film how-to videos for families to do it at home. So it's not only going to benefit our program clients, but it's also going to assist the veterans at the same time. As the veterans come in and assist us with the therapeutic garden, we also had an idea to have them benefit from our programs here, like the mental health program that we have here for veterans, as well as healthy living programs where it comes with where Tai Chi is offered, pre and post lab work to check how healthy they are and to get assistance on nutrition, things like that, so they get to benefit from our programs as well. The how-to videos I'm really excited about because, again, with COVID upon us, it's with our families, it's very hard for them to go out. So it's something that you do at home. It's therapeutic for them, and then they can enjoy their harvest once it's grown. So that's a new project that we're working on, and I'm excited about it. The 3 new activity videos that'll be coming out for Christmas are again for sensory, for children at home while they're out of school. It's going to include a sensory activity project that includes music therapy. So those will be out during Christmas break. Also on December 19th, I'll also share the flyer with the group. I'll send it to Ms. Martinez. We'll be having a workshop for caregivers. This workshop is going to offer the parents and the caregivers tips on emotional, mental, and physical health and the importance of it. I really felt that this holiday season, it was difficult for a lot of families. And I know right now we do focus, our goal is to focus on the child and the young adult, but sometimes I feel that we leave out caregivers and their own health. So we decided to do this workshop. I'm really excited about it because we have many resources for them. We're going to be following up with them, and then of course emphasizing that a healthy caregiver can offer better caregiving. So those are the projects that we have coming up and we completed. But I'm really excited again for the Therapeutic Garden and this workshop, because this is the first workshop we'll be conducting for this program. And it's going to open us up to, again, additional workshops like health transition for adulthood, transition into the workforce, also continuing caregiving health and well-being.
Thank you, Christine. Thank you for the report. So let me ask you about the gardening. Do you all have is that the garden that's outside of the clinic? There's these little boxes. Is that it?
Yes.
Because I have one of my kids that was into gardening for several years, right? And we never could make anything grow. But one time, and it would get full of weeds and stuff. So it was like a lot of work. And he wanted to do it all the time. And I was like, no, I don't want to do it because I'm the only one out there cleaning and de-weeding and stuff. But but one time that we went, I don't know why he accompanied me to the health center, to the health clinic, and there was a box outside out there with a bunch of green vegetation growing real healthy and green. I was like, I hope he doesn't see that.
No, this is very exciting. This project brings together a lot of different initiatives that have been derived from the health department, the urban agriculture component, where we do want to encourage anyone to look into whether or not, I mean, I'm the same way. I can't grow a plant or anything like to save my life, but I keep trying. But we have that. We have, of course, reaching out to our special needs population that can find us therapeutic, and our veteran population. So having that, coming together of all these different facets is very exciting for us. So we look forward to those videos and the results of this program. I do see Mr. Chamberlain has joined us. Christine just gave her report on our special needs program. I know we are, you actually come in right on time because they want a COVID-19 update. But I'll give it back to Mr. Chair, Mr. Castillon.
Good morning. How are you, Mr. Chamberlain?
Good morning, Mr. Castillon, and good morning to everyone. I apologize for my tardiness. I'm jumping out of one meeting into this meeting, and I will be exiting at 11:55 to jump into my media briefing that we have going on every Wednesday once again. So our media briefings are being provided Monday, Wednesday, and Friday. Prior to 3 weeks ago, we were not hosting them on Wednesdays, but now we're back up to 3 times a week since we have experienced a increase of overall cases that are being reported on a weekly basis, an increase of our hospitalization rate, and then of course an increase of our positivity rate. So currently our positivity rate is sitting at 14.7 over the last 7 days. Our hospitalization rate is at 29.9%. Our highest was at 32.4%, which was 4 days ago. So we've had 3 consecutive days where we've come down. Not very much though, from the 32 to the 29, but it is something that we are very fortunate still though. We will take coming down from the 32%. We are very hopeful that we don't get to the level where Eagle Pass was very much struggling and on the verge of catastrophe medicine. Just a couple of weeks ago, where they were surging at 45%, which was very, very scary for their jurisdiction. They were transferring patients, of course, within the state of Texas and out of the state of Texas. Patients were going to Dallas, San Antonio, Corpus, McAllen from the El Paso area. So we're very hopeful that we don't get to that point. Just to go back a little bit more though to testing, we've had experience a little bit of a cut back on the number of tests that Curative are providing. Curative has run into a capacity issue at their headquarter lab in Round Rock, Texas, to where they needed to be able to ensure that samples that are being processed are results are being provided within 24 to 48 hours. So they scaled back on their operation. They were doing anywhere between 550 to 700 tests a day for the Laredo community. They had to scale back, set up by appointment only, and that has scaled back their operation to between 300 and 400. But because of the demand also in the community, we are still seeing over this past weekend, we saw that there was no availability of testing. So we did reach out to Curative. We did add a 5th site, which is at Slaughter Park now. So we have a 5th site at Slaughter Park amongst the 4 sites that have already been set up. We are still waiting for our 3 additional sites, but that 5th site is now live as of Tuesday. And they have increased from their 300 to 400, a little more than 400 now at each site, but those are by appointment only to help facilitate the operation of getting the results to the individuals within 24 to 48 hours. As always, though, you can count on us at Health here. We don't have the capacity that Curative Lab does, but Health Department is still providing testing for those who may have been exposed, or more specifically for epidemiological investigation. So once we do identify a positive case, then absolutely we start working our way out via contact tracing and making sure that testing is provided for those individuals who have been exposed. So that is at 956-795-4932 for us here at Health. That is our line to be able to get through to testing. Of course, that line is pretty much busy all the time. So I do ask that we are very patient with them, and that also we are very patient with our Curative Lab. Now switching over to vaccines. Of course, vaccines did arrive in Texas on Monday to 5 sites, and on Tuesday, yesterday, to 18 sites for the initial 23 site rollout. We do have 110 sites that are approved in the state of Texas for allocation during week 1. There is a remaining 87 sites who will be receiving vaccines. Of course, today they're being shipped, so tomorrow, Thursday, and Friday. So we're very hopeful that we get our notification from Texas Department of Emergency Management and the Texas Department of State Health Services this afternoon, letting us know that Laredo's vaccines for our healthcare providers, which is going to be our staff at the hospitals, will be that we will receive them tomorrow. So that is a moving date. We're very hopeful that it stays tomorrow, and of course we will provide updates to the community as that information is shared with us. So with that, we are getting 2,925 vaccines for our healthcare providers in Laredo. And the state of Texas Expert Allocation Vaccine Panel has provided us guidance as to how those are administered. So we do have our phase 1, tier 1A, and that does include our hospital providers, our healthcare providers at the hospitals, and that includes, from the top to the bottom, from the doctors to the environmental individuals, the custodians who clean up. That is very important for them to also be protected, as they are exposed when they are cleaning up rooms, or the physicians when they're providing care, or the nurses, or the X-ray technicians, or the respiratory therapists. They're all getting that access first, as they are on the front lines. So that is being provided at Stat Hospital, at Laredo Medical Center, at Doctors Hospital, at Laredo Specialty Hospital. Once, of course, we know that we have all of the hospital staff covered, of course, those who are consenting, and we're happy to say that we do have about a 75% consent to get vaccines, which is great. We're working on those other 25%. We're very hopeful that those other 25% of our hospital staff do change their mind over these next 2 days to get their vaccine, and any additional vaccines, which we're guesstimating as of right now that it'll be a couple hundred, will go then to our long-term care facilities and their staff. After that, then we do turn to our emergency response 911 staff, which includes, of course, our ambulances that are city-owned and that are non-city owned, of course, are private, and then going into our home health care and hospice. So that is our tier 1A. Followed by that, then we do have our tier 2. In our tier 2, we do have our outpatient care facilities, which is basically our doctor's offices that are included into tier 2 of phase 1. We do have our school nurses. We do have our public health emergency preparedness vaccination response staff, our medical examiner and funeral services staff that are included into phase and our standalone ERs that are included into phase 1 tier 2. So that would be our next allocation. We don't have specific dates yet that are set for that phase or that tier 2 to start. We are still, of course, in week 1 of allocation for phase 1 tier 1A. So we are very excited that we are obtaining vaccines to help protect our staff at the hospitals. And what is very much exciting also is that there is an application that I will encourage everybody to already have downloaded on their phone. It is entitled vSafe. So vSafe is a smartphone-based tool that uses text messaging and web surveys to provide personalized health check-ins after you receive COVID-19 vaccination. Through vSafe, you can quickly tell the CDC if you have any side effects after getting the COVID-19 vaccine. Depending on your answer, someone from the CDC may call to check on you and to get more information. And vSafe, most importantly, will remind you about getting your second dosage. Since second dosages are extremely important with our Pfizer vaccine, it is on day 21. You do have a 4-day grace period. So day 21, day 22, day 23, day 24, day 25. And with the Moderna vaccine, of course, which they meet tomorrow to provide the recommendation from the FDA panel for EUA authorization. So we are hopeful that we do hear EUA authorization for Moderna as early as Friday. Moderna's vaccine, of course, is 28 days after the initial dose, and then you do have your 4-day grace period for that. It's really important that we stick to the same vaccine to be able to acquire that 94, 95, 96% effectiveness for providing an immune response to for us to keep us safe in the community. So with that, I can share also a frequently asked question is if I've been a previous positive COVID-19 case, can I get my vaccine? Absolutely, you should get your vaccine. Is there a specific time that you should wait? You should wait till you're recovered from symptoms. So there has been, I've heard from some physicians that you should wait 90 days, but we've gotten specific instructions from CDC and DSHS letting us know that you don't have to wait 90 days post. You just have to wait till you're recovered. So if you've recovered already, of course, 10 days is the minimum to end isolation and for recovery. If you've recovered by day 10 and you don't have any symptoms on day 12, then absolutely get your vaccine on day 12 when it is provided, of course, into the separate tiers. After we do have tier 1 and tier 2 of phase 1, then we will move into phase 2 where we expand more to the critical infrastructure workers of the city and other populations. So as soon as we do get more information about how that is going to be broken down by the expert allocation panel provided by Texas Department of State Health Services, we'll make sure to share that with all our groups and all our committees and, of course, our stakeholders and the Laredo population. I've kind of ranted for the last couple of minutes. I'll go ahead and take a pause and answer any questions as we may have.
I have a question, and as far as it's a clarification, this is Dr. Georgianne Ruthinger. You said the app is called, is it a vSafe?
Yes, ma'am. vSafe.
Okay.
Vaccine safe. Yes, ma'am.
So
we do want everybody to be very much aware of it, as we do know that there was more than 44,000 individuals that did enroll into the Pfizer vaccine study and trial, and it was very safe and very effective. But it is important for us to be able to provide continuous data to ensure the overall safety and efficacy of the vaccine. So as we begin to roll it out to hundreds of thousands and millions of individuals, getting all that data in will just help solidify the safetiness and efficacy of the vaccine.
Mr. Chamberlain, please give me a clarification because I'm not sure if the data I have is correct. The first vaccine gives you 50% efficacy and the second gives you 95. Is that correct? There is not a clear, but it's between 50 and 70% from the first dosage. And the second is?
We'll give you the 95, the 94, 95, 96%.
Thank you.
Yes, ma'am.
Thank you, Mr. Chamberlain. Can I ask you a question? Is there something that our citizens are doing differently that the infection rate is so high compared to other communities?
So First of all, our infection rate is high in Laredo because of a number of factors, but we just recently came off of the Thanksgiving holiday, and after the Thanksgiving holiday, we had a 7 to 28 day period of where we were going to see an increase of cases. So we are definitely seeing that last week, this week, and next week. And what is very concerning for us is that we still have Christmas coming up, where there will be more gatherings, as much as we are advising to not gather, and followed by the week after with New Year's, which we're still advising not to gather. We do have our order right now, our public health order, which is, of course, very difficult for many to not host any social gatherings at homes after 10 o'clock. So that is something that is being enforced. But that is one of our main concerns, or one of the reasons why we are experiencing a high number of cases. And actually across the state of Texas, across our region here in South Texas, we're known as Region 11. We have meteorically or had a rapid acceleration across all the state and here in South Texas as well. But here in Laredo, we observe it a little bit more or heavily because of our capacity for providing hospital beds. So we do have a limited number of hospital beds within the Laredo, and we'll call it the Laredo metro area, because we do have Zapata, Jim Hogg, Duval, and LaSalle County who count on us as well as a center or as a location for healthcare or acute healthcare. So we're not only providing services, of course, to our population here in Laredo and Webb County and our surrounding cities in Webb County, but to those counties as well. So they look to us. So with our hospital capacity being 540 licensed beds, but of course, some of those are labor and delivery, so those are not included into just general care. And then the staff shortage that we are experiencing here in Laredo, across the state, across the United States, does put us at a disadvantage for being able to provide that support to our severe and critical care populations of COVID disease infection. So right now, we're still not at our capacity of hospital beds because we don't have the staff to man the beds. So that's where our deficiency, and the state has been trying to get us to that level, but also they're having difficulties with accessing staffs, and staff have also applied to other staffing agencies, and they have been taken out of state or to other areas of the state as well. So it's a difficult situation. Of course, we're working through it with our emergency management coordinator, Chief Hurd, who has been making the requests for staff continuously, and we have been getting staff healthcare providers into the city, to our 4 hospitals, and even into our COVID nursing home, which we do have as well. But we are looking at other alternatives, of course, setting up more sites at more beds at another location and acquiring more staff. That is something that we're planning for due to the upcoming Christmas and New Year's holiday, which we know that we will have another rapid acceleration of cases. So if we look back to after the Memorial Day holiday and the July 4th holiday, we did have a period about 2.5 months, 3 months of high incidences of infections in the community. So we have observed the increase of cases over the month of November, a significant increase right after Thanksgiving. So we're forecasting that this high level of incidence of infection will not subside until mid-February. So it's very much, it's something for us to be very much aware of, and to continue to just practice what we've been sharing with everybody since the beginning of our local pandemic, which was March of this past year, which we're very much tired of. COVID fatigue is very real, but nobody really wants to hear it every day. Of course, it's something that is ingrained into our thought processes, which is wear your mask, social distancing, don't go out of your home if you don't have to, don't have others over if you don't have to. But that's something that we have to continue to practice as we get more vaccines in to our local community, into the state, across the United States, to be able to bring that immunity level up to then where we can have some type of normalcy kick in. We're very hopeful that it's sooner than later, but I will be realistic and say some type of normalcy is potentially October, November, or December of next year. Once we do know that there are high levels of immunity in the community, even though that we should have more mass vaccination as of April. Like I'm talking about, large populations as of April, May, June of next year, if not, of course, latest at the by October. So that's why we're saying October, November, December would be more normalized months. Yes, ma'am.
When we're talking about dates, Mr. Chamberlain, phase 2, you mentioned phase 2, more or less, plus or minus, however, standard error measurement, more or less, when do you think phase 2 will start?
April 2021, sorry. That is, and I will all say big disclaimer, these are all moving dates.
Right.
But April 2021.
And then that would address other critical
infrastructures, populations. I'll just share, I don't know that if this is fact, but I'm thinking that, it'll go into our homeless population, our correctional facilities, our cohorted populations, such as, our orphanage. So those group settings will have priority, as I've heard through the grapevine, before we do get just to, our everyday households that are healthy individuals that can still protect themselves, of course, because they have their own dwellings, versus those who are in cohorted living situations.
Thank you.
Yes, ma'am.
So, Mr. Chamberlain, I have a question. I understand that the city of Laredo medical systems are losing staff, typically nurses and RTs and stuff like that, to the state of Texas. The state of Texas is hiring them at very increased salaries than what they're used to earning here. So the question is, it makes a vicious circle where people are being hired away, and then we ask the state to fill those vacancies, those holes. Has no one thought of submitting some type of legislation or some kind of where the state of Texas needs additional staff? That's fine, but they need to hire them from outside the state as opposed to hiring from within, because they're creating voids and vacancies within the state, and then they're bringing in their own staff to fill those patches.
Absolutely. Actually, we just received a letter today from the state contractor who is hiring these nurses, respiratory therapists, respiratory techs, physicians, that they will no longer be, quote unquote, being predators and taking them away from our community. So that actually just came through the grapevine today. That letter was shared with us here locally, and of course the providers or the healthcare systems across the state of Texas, because we have noticed situations where staff from one hospital left to work for the state contractor and ended up at another hospital here in Laredo. But the hospitals have already collaborated with each other, and that they will not accept staff from each other's hospitals, as it does hurt us. And of course, the state of Texas is now focusing on areas that are being hit very hard. We've been number one in the state of Texas for hospitalization rate for the past 4 days. And that staff that have addresses that are applying to their contracting services within Laredo will not be picked up as well. So they're going to be basing it off of your TSA region, the overall percentage rate of your region. Of course, if you have a 2 or 3 in your region of percentage, then they don't really mind picking up staff and taking them over to other areas. But for us right now, that we are at 29-30%, they shouldn't be taking staff away from our area. So they're very much aware of that already, and that will be put to a halt as of the letter that was sent out today.
Thank you.
I apologize. I have 4 minutes to jump into my other meeting. So I want everybody to know that we are here for you all. We are very accessible. Of course, right now I'm going to jump into another meeting, so accessible might not be so accessible as of this moment, but I'm glad I was able to come in and share a little bit of insight on the COVID-19 response that is going on in our community. And I know we won't be meeting until the new year, so I want everybody to have a very safe and restful holiday season. Of course, keep it to yourselves, your immediate families, so that we don't have this continuous rapid acceleration of COVID-19 in the community. And I want to say thank you to everyone for everything that they do within their own organizations and agencies, and what you do also for your families. It's extremely important that we continue to maintain our strength over these difficult times,
Really
especially over the
don't.
holidays. So I want to say thank you very much, and you all have a great rest of day and afternoon, and we will see you all in the new year. Thank you.
Thank you.
Bye-bye.
So is everyone back?
I believe so.
Okay, because my screen went blank. So
So I think Richard came in just in time to provide you very thorough update on our COVID response and the current trends here in the city. We cannot emphasize enough to really practice those precautions with wearing your mask, with exercising social distancing. It's very difficult, I know, with the holidays. I keep it very present that, I mean, I saw something in social media that said, you know, a distant Thanksgiving beats, you know, an ICU Christmas. And I really think about our relatives that might be immunocompromised or just have higher susceptibility for complications. So it's been difficult, especially for me personally. It's my baby's first holidays, but we do a lot of FaceTime. My baby's very knows what the phone and the iPad are for. They're for grandma and grandpa to be the picture there. But we just have to keep strong and move forward that way until it's a little safer. But like Richard says, you know that he is accessible. He makes every effort to come to the meetings, and anything that needs to be relayed to him, I'm here to provide that to him, and any other additional information that's needed, we'll get it to you.
thank you, Erica. Yeah, and we appreciate his presence. I mean, he's a wealth of information regarding the situation, so we thank him for that. Just let him know. Can we move to the following agenda item, which is primarily just if anybody has any other information, additional information that affects the population that we serve in regards to the COVID-19. If there is any other additional information that anyone would like to share?
Mr. Garcia,
Yes.
I think it's good to repeat one of the last things that Mr. Chamberlain shared with us, and it struck me because he said for the past 4 days, we are #1 in the state for hospitalization.
Right.
I think all of us need to really think about that as we move forward. Most of our members, I consider very important people that have a great deal of influence in our community, and I hope that we can share that with others, and perhaps that will discourage other people from getting together in groups, because it's very hard. Our culture is, getting together and sharing, especially in the holidays. There's the tamales, and and it's just very hard not to be with people we love. But just to remember that the past 4 days, we have been #1 in the state for hospitalizations. Nobody wants for our loved ones to be in the hospital. And I see people walking around as if, times are normal. Mr. Castellon, this is not a normal time. And as frustrated as we all are that it's been since March, we need to hang in there and just not get together, as hard as it is not to.
I agree with you. I don't think that people sometimes understand the seriousness of the disease that we're encountering. It's deadly. It kills you. And you don't necessarily need to be very fragile and very old. Okay, it's taking people that are in their 30s and their 20s, and
it's a horrible death if you study.
and I was in communication. You and I were speaking a little bit before the meeting also, and many individuals have resulted in having to amputate their limbs, their legs or arms as well. And so it has long-term effects, not only beyond just the disease, Okay, it can affect your respiratory system for life as well. And so there's a lot of secondary long-term symptoms that individuals are going to have to deal with for the rest of their lives as well. So yes, it's a very serious disease, and I think people need to take it more seriously and take care of themselves and their families.
I'll share real quick. I have a lifelong friend. I had a lifelong friend, and brilliant person. He was a criminal attorney in Houston, very successful for many years. He finally decided to retire about 2 years ago, and he spent a lot of time at his family ranch. And I'm talking a very fit, very healthy person. He got COVID and it killed him. And so it isn't just the infirmed or the fragile or compromised. It is a very deadly disease, and the death is horrible, horrible. So we need to be very careful and remember this is not normal times, and we need to, as much as we can, isolate and take care that way. That's the way we're going to take care of the people we love, by staying away, which is very counterintuitive, but we need to do it.
Yeah, correct. No, and I think that one of the difficulties that I think our society has had and our country has had, and the number of people that have gotten sick, and the infection rate that we're the highest in the world, okay, and yet we're one of the most intelligent communities supposedly, is that unlike other countries in the world, the United States had never had to deal with anything like this before. You know, the last time that we dealt with something like this was more than 100 years ago.
The Spanish.
But some other countries have been dealing with infectious diseases for years. And, you know, often when we went through the airports, we wondered why all these individuals were running around with masks, and they mostly looked like they were Asian. And we were like, well, what's going on? Well, it turns out that those countries have been exposed to these kinds of diseases for years. And so they're much smarter. They've had much more experience than we have had. And so I think that's one of the challenges that we've had in this country, is that we're so used to being independent and having no concerns because we have never been exposed to a disease like this before. And so I think it's important that people understand that the potential to become infected is everywhere and from anyone. And so we need to be very cautious and continue to take care of ourselves.
This is a good time to be OCD. This is a good time to be obsessive compulsive disordered and a germaphobe. Everybody be very careful.
I agree with you. Let's see.
Mr. Chair, if I may, we could hear maybe from the school districts. I know it's been challenging with remote learning, and especially for specific population that we address through this committee, which is those individuals, those children with special needs. I really would like to get some feedback in the polls as to what challenges or obstacles, or how the city can provide support with any challenges that you are facing. I think you would provide, as stakeholders, a very interesting perspective, especially for this specific demographic.
Well, hello. As far as the city helping us, I know people have tried to get the access points, so that's made remote learning a little easier. Here at LIC, our population is not, we have very few students actually on campus. Most of them are doing remote because of, again, they are medically fragile some, and, you know, parents are afraid. I know I have sent some to the free clinics that you have sent us, so that has helped a lot as well. And I guess it's just, I mean, I know Ms. Reyes mentioned the.
Can you all hear Ms. Morales?
I'm having problems hearing her.
Yeah, she's breaking up.
Sorry.
Yeah, I hear you
Is
a
that
little
better?
far away. I'm trying
Is
to
that
make out
better?
what you're saying.
I don't know what
We're lip reading here, okay?
Sorry.
All right.
Is that better?
Yes.
Just get closer
Okay.
to the mic, please.
Okay, so basically, I mean, those are some of the things that we've used. I know we're providing the meals for them, grab and go as well. So that is helping a lot of our population. And pretty much with what Ms. Reyes said about the caregiver, I know we've had parent sessions for parents on how to, stay quote unquote sane and take care of themselves, because it is somewhat difficult to have several children at home and all online, and everybody trying to get educated online while there's one computer, and it's things that they do run into. We have given devices. I mean, pretty much we're at a point where I guess we're just waiting for vaccines. I mean, I know my daughter works at the hospital. She is a nurse. She'll be one of those first people vaccinated, and it's just staying safe and not getting together. I mean, we tell our parents all the time. However, you do see all the kids at Walmart. You do see all the kids at, different places. And it's like, what are you doing here? You're supposed to be home. You don't go to school. What are you doing at Walmart? But, we put it out there, stay safe, stay home. And it's just a matter of people listening. I really do want to thank you, Ms. Erica, for sending that information, because it has been very helpful. And Ms. Reyes, we are sending the flyers and letting them know about that as well. So just FYI.
Awesome. Well, thank you so much for that feedback. And it's very comforting to hear that we're on the right track, that we try to really consider the information and resources that are needed, especially for those, it's just the reality of it. We're in the hustle and bustle of this. The pandemic has affected everyone greatly. We're in response and survival mode at this point. That often, when you don't experience it firsthand, they may be overlooked, special needs populations that require additional resources or assistance. You might just, not think of that. Veterans that go through mental health situations, PTSD, or that also need additional resources, support with, workforce entry. I know that coming back after enlistment, there it is an adjustment period, and now with the world so different, that adds that extra component. So please, we're all ears. We are very fortunate to have individuals like you and all of you in the committee, like Ms. Reyes, that really considers, what it is what type of information is needed to be relayed. So, but please, you guys are our guidance as well. So feel free to let us know what you identify as additional needs, and we'll definitely work on that as well.
I guess my only wish would be more Wi-Fi, because I know we've had buses, and I know Mr. Garza and I have worked with, okay, where's the bus located? This child can't get access from yours or ours, and so that would be the only thing. But other than that, I mean, I know we're all trying to do the best we can, and it is appreciated from all sides.
Okay, I have direct communication right now with our IT director. They are working on a project here at our facility. So as soon as I see him, I'll definitely relay that to him. I know it gets a little difficult. As many of you may know, we did receive federal funding for CARES for COVID response, called CARES funding. That actually ended or ends at the end of this month, and we're kind of, in limbo, waiting to see what the next steps are. Some of that funding was appropriated for these Wi-Fi hotspots and stations, but the city is definitely committed to sustain them and continue them one way or another. So I'll definitely relay that this is something critical. It's something that is being used by the students here in our community.
And to piggyback on that, absolutely right. We, Becky and I spoke about one of our students we had in El Cenizo. And I actually drove out there to the house, and I was telling Becky, the buses are, one of the buses was a block away, and the other bus was 4 blocks away. And yet the parent could not pick up the Wi-Fi, so I had to take them on my fi. So there's issues, there's like, I guess, drop spots, or I don't know what you call them, dead zones, I guess. And it's very difficult. We have provided a lot of Wi-Fi's, technical support, equipment to the parents. We do have in-class instruction, and now we're providing therapy online as well. But it's the teachers, in their defense, they're completely overwhelmed and stressed out. It is, by the time they're done at the end of the day, my hands to them, they are exhausted because they're teaching the students in class as well as the ones online. And we've logged into the classrooms. I'm sure Becky has too. And you see, the students, the parents trying to redirect, or the parents sometimes don't pay attention to the student, and the students off task. Say, hey, please refocus or log in and so forth. But those is just the new, I guess, the new norm for right now. But our primary concern is safety first for our students as well as for our staff. So I'm glad you're out there, because we'll be using you as well. This has been a learning experience, I think, for all of us. Big learning experience.
Yes, it has. And if I could share, we're in meetings ourselves because we're teleworking. We're all blessed to be working out of the house. So the state has set us up, and we do everything that we can do, right? We do have curbside, right? But in one of those reports, it was reported that when you're working like this and you're in front of the computer, that it takes a toll on you. Like if you were a smoker, it takes that effect on your body. So they're talking about get away a little bit, go get some exercise, and, stay busy, because really, I mean, you finish and you're like, what happened to me today? But yeah, those studies are showing that it does take a toll on your body. I'm not complaining. I'm just saying the study shows that, it's not healthy. So we got to try and stay healthy by getting some exercise in and doing our due diligence to keep our mind fresh too. But I did want to share that.
Yeah, that makes sense. I can relate to some of that. Like I was telling my husband yesterday, like your joints start hurting from like from all day, and with my fitness tracker, it's like you don't even reach 1,000 steps in the 8 hours you're just on the computer. So yeah, it's definitely, you have to be mindful of those things to keep healthy and to build that, immune system, ensuring that, we do what's best for our bodies and our minds. So thank you for that, Ms. Sanchez.
Yeah, typically we don't do very much exercise if you don't do it intentionally, because it's not until you start like walking that you realize the effort it takes to walk like a mile. And then you say, you know what? Typically in a day, I don't get anywhere close to it. So yeah, we're like somewhat under exercised, okay? And so with this environment, this atmosphere, becomes even easier for us just to not do anything unless you intentionally make an effort to do something. And so, yeah, I thank the school district's information. I think that it's important that we realize that it's taking a toll both on the teachers as well as the students, and I can vouch for that because I see my daughter is still in high school and she's like on the computer from like 8 in the morning to like 3:30 or 4. I'm just amazed that she can stay up and be attentive for so many hours. Just amazed, okay? For college kids, I think it's easier because you just look up for an hour and a half or whatever it is, and then you leave. And so it's as challenging, but not as long. But for the kids in school, in high school, elementary, it's just become very challenging. And I know like in the state of Texas, there historically there's been like a failure rate of like 9 or 10%. Right now in the state of Texas, the failure rate's like 40 something, like 45% or 43%. Just increased enormously because kids are having a real difficult time trying to learn online. And so it's not as easy to replace the teacher classroom environment setting via a computer. So yes, I think we've all learned quite a bit. So if does anyone else have anything else to say today?
Mr. Castillo, just in passing, the announcement about Oda Garcia no longer being with us, she is with the state. I was wondering if we could add that to our notes for today for our meeting that Christine Reyes is substituting for now. If that could be part of our notes, please.
Sure.
Yes, ma'am.
Really.
Thank you.
You're welcome. So let me move on. Are there any other final announcements that anyone would like to make? Other than I wish you all a very safe and happy New Year and Christmas holidays. Just take care of yourself. Be safe.
Likewise, please be safe, and let's try to still enjoy the holiday season in a newfound way. But definitely thankful for health, and the fact that we're still here. We still have the commitment towards our beautiful community, and I know that together with these efforts we'll make it through. So please, if you all want to see anything for the upcoming meetings, let us know. If you have anything in mind in terms of presentations or speakers within the city of Laredo for additional information, I'm open to that as well. We can continue having our special needs program report monthly. And of course, as you see, Mr. Chamberlain makes the effort to come into the meeting to provide any COVID-19 update. So I do see our next meeting will be third Wednesday. That's the 20th of January. So we can go ahead and look forward to that, unless otherwise, said by the committee. But we've been pretty consistent. I really want to thank you for your commitment to continue the momentum with the Blue Ribbon Committee. With attendance, with meetings, it's really one of the highlights for City Council and the Mayor's committees, because you guys have always been very active and committed to the purpose. So thank you for that.
Well, thank you to the rest of the members. I know that's
Sorry, excuse me. Sorry, Dr. Castillo. Mr. Castillo. I wanted to share. I just remembered. Sorry, because today it's been one of those days. Sometimes my days are like scheduled and good, and today's just the babies are just all over, so they change everything. So the plans that I have, they're not there anymore. I do wanted to share right now in regards to I was thinking about January, and I'm like, I know there's something coming up in January. There's something that we've been working on. I know we did this about 2 years ago. It's for the blind and visually impaired, and outreach for more providers, vendors to join us. And we are planning something, I want to say, either it's going to be for the end of January or the beginning of February. But just in regards to getting more referrals in place again, because maybe they hear about us once and then they kind of tend to forget. I did receive a referral the last time from the city of Laredo for, what was it, about a month ago. So I was like, ooh, it's working. But we will be trying to have like a virtual presentation. That way more providers, vendors can join us. And again, we're going to try to reach out to, like, example, for the school districts, for the VI teachers. We do have our transition counselor, which she might be on leave due to her having a baby soon. So maybe they might not be able to meet her, but we were thinking about, hey, at least a picture, because we all tend to, we're all working from home. But know that that's coming down that's coming down the pipe, and hopefully we can get more referrals. So if you know of anybody that is interested in wanting to learn more from us, we'll be sending a flyer out. But just know that that's going to be happening in the end of January, possibly the beginning of February. Okay.
Thank you, Ms. Miguel.
Thank you.
It'll be a
You're-
virtual
you're-
platform, right? We want to share that we're going to do it on Microsoft Teams, virtually, of course, due to the social distancing and whatnot. And we'll extend an invitation, of course, to the BRC if anybody be interested in attending, right?
That's
Martha?
perfect.
See if any of the partners, because a lot of people don't know all the services that we have, and they think, well, what else do? Do you find work? Yeah, we find work, but that's only one of the things that we do. So, we're about employment retention and employment. So if there's an impediment to employment, that's where we come in to bring those supports to assure that we can help that individual maintain employment or obtain employment. So that's the core, and those are the outcomes that we're looking for. We have a lot of money. Not too many people can say, we get a big bag of money. We got a big bag of money, and we need to serve those people. So, yeah, thanks for that, Martha. That was good.
If I can suggest, I know that the members of the committee are aware of what the members, the resources that are available through the agencies they represent. I know Miss, oh God, her name escapes me. Oh my God, I'm totally blanked.
Who's the person? What does she look like?
What's the
She
picture?
just made a presentation. It's lunchtime, guys. My brain's like not.
Ms. Reyes?
Al, Jackie, who?
Jackie, Miss Jackie, yes.
Jackie, yes.
Provided an amazing presentation of what the agency does through this medium. Shifting over to a web-based meeting gives the opportunity. Of course, like I said, we are sharing not only the link, but the password for people to be able to join now. But the meetings are live streamed. Anyone could have access through that link to view live what is being discussed by the committee. So I think it would be a good platform if next month we could place you on the agenda and you can provide just a brief overview of the resources that are available, especially now during, through the pandemic, and how to go about, reaching out and securing these resources. I think that would be something good for not only the committee, a good refresher, but you never know who's watching,
Oh, absolutely. Sure. Put us on, and I'll let Ms. Jeanette know that, we'll be presenting at the next meeting. Absolutely.
Perfect.
Mm-hmm.
Thank you for that suggestion.
I'll make note of that.
So you're on, Diana, for next month.
We're ready and we're on.
And make sure you bring the deer background again.
See, no.
We're gonna have a little cutout.
Quiero ver un venado.
No, but also I wanted to share, with the social, before we go, and I know it's past lunchtime here, but real quick. So the state, of course, has invested in this amazing platform, and several partners here have partnered with us, but we really need to take advantage of that, because we can't have those job fairs, we can't have these symposiums, we can't have any of this, but we can do it on this platform. So we were blessed to be able to we've done a career exploration fair, which was very successful. And then here recently, we did an event for our internal customer for resources. So we just had a region-wide event to bring resources, what community resources are out there. And you'd be amazed that, you've lived here, raised here, born here, and love this community, but you're not aware of all the resources out there. So it was really, really good. It was networking. Of course, it's on this virtual platform, which we call Easy Virtual Fair. And we're planning to do a job fair in April, and hopefully April could be more a time for people, because jobs are out there, we understand people are hesitant, but April 22nd is the day that we're planning a job fair. So we look forward to that. But hopefully, I'd like to possibly, even if we could just navigate that, we can throw that into the presentation that we can give you all just a little snippet of what that platform looks like and how that works to kind of help educate us, because people are like, oh no, technology, get out of here. Anytime I'm scheduling with a partner, I say, you know what, if you don't feel comfortable, give me your tech savvy person. We'll talk to them. And then we get it going and we're good. So, we'll make it work. But I think we're going to add into that little presentation just a snippet to give you all a real view of what that looks like. We can go in the demo, but I think it'd be a good idea.
Miss Diana, I love everything that y'all do for the community. And anytime that you have any kind of links we can add to the Blue Ribbon Committee website, I'd love to have those. But I think all of those, like you say, all those connections, sometimes we live here all our lives, we're not even aware. But if you could share maybe some of those links so that, more people can be aware, it would be great.
Yes, through one of these, I ran into this organization. They're called Aid the Silent. So they're out of Bernie, Texas, and they were found and co-founded by a mom and a daughter. So the daughter is the one who is deaf. She speaks very well because she's had great training, but it's an amazing organization. And of course, I call and I say, this is Diana Sanchez. Oh, hold on. Boom, they passed me with Puente. Okay, well, I'll talk to Puente. I guess they didn't think I could speak the language. I don't know. But anyway, so we're having a great conversation, right? And they're in the middle of planning a pop-up tent in the Valley. I said, why is the Valley always eating our cookies? Laredo needs that help here too. Why can't you do a pop-up tent in Laredo? I said, why don't we partner and see what we can do? So they serve age 0 to 18 or 21. And I told them we start at age 14 and older. But we had some really good dialogue. So they're doing these pop-up tents. And in the Valley, they did 22, I think is the number. They're a 501c3, so they're nonprofit. You put in all your application. It's an application process. If you're approved, then all the team is a traveling team, the audiologists, the doctors, that, everybody that they need. And they just pop up the tent. And she said, we are actually looking at an initiative to work the border. I said, the border needs you. And we're here. I said, so just call us, let us know when you're ready, and we'll put it together. I mean, Erica, we could definitely partner with the health department, to do some type of this pop-up tent that they're needing. I mean, they're bringing the resources. We're going to find the people, 22 people. That's how we can find 22 people. I guarantee you we can find them at that age, right? And I know the school district, Rebecca, has the deaf, right? Is it Cigarroa?
Yes.
Cigarroa?
Yes.
Yeah. That people don't know these resources are here.
And this triggers in my mind, we were actually working with TAMIU on an initiative prior to the pandemic. We actually have a booth available for the auditory screenings. And we were going to get students from TAMIU to kind of practice on that. And so this would be a great way to kind of link and expand, for a better reach, the resources that are made available. I know with the pandemic, everything kind of stalled or got to standstill, but we need to start being able to consider integrating these efforts back, these initiatives.
And they bring, I didn't mean to interrupt you, but they bring all the precautions, they got the gloves, the shield, the mask. I mean, it's required. And of course, that is required of the customer or the parent who brings the child because they're serving a young age. But I mean, I think we can collaborate easily and do some type of partnership that we can do a pop-up tent here in Laredo. There's such a need.
Definitely. Yes. Whatever's needed on our behalf, please feel free to reach out so that we can make it happen.
Yeah. And I'll update as soon as she gets back to me because we're going to do another pop-up, but she committed to get back to me. So once I have more information, we'll keep you abreast and see how we
invite her to the next meeting. We could put her on the agenda. I want to make sure that the time that we have, I really do appreciate the time that you guys take to come into these meetings. I want to make sure that it's as productive as possible, that you get the information that you need, and that we're able to expand that reach, like I said. So feel free, Ms. Sanchez. I'm sorry if I'm overstepping, Mr. Castillon, but I think it would be great to have them, if they're willing and available, having them on the agenda for just discussion on what the possibilities are.
Yeah, I think that's a great idea. I'll reach back out to Ms. Puente and see what their schedule looks like, because I know ours are standing meetings, and I can give her possibly a couple of days to see who we can squeeze them in, and then of course I'll forward an email to you and Andrea to see how we can get them on the agenda. But that sounds like a great idea. But they're amazing. I mean, they do these great things. They have huge, huge, huge supporters. They've got HEB, and on their board, there are all these doctors, audiologists, people who really know what it takes to support these individuals who are deaf. So why not?
It's
And
perfect. That sounds
just as an
amazing.
FYI,
Yes.
just as an FYI, we do have our audiologist, Dr. Oliveira, that is the one currently in town. She does service our kids monthly, so we do round, and we do have Jim Hogg with Consolidated Zapata County, United, and Laredo ISD as part of that weekly, monthly rounds. So if anyone is needed, right now rounds are happening virtually, but if they are school age and we are servicing, we are providing those rounds with them as well. So Dr. Oliveira is seeing some of those kids currently as we speak, for FM issues, for device issues, for anything that's coming up like that. Virtually, but it's happening.
Well, good. Yeah, that's good to know. I don't know I'm gonna follow up with them to see what exactly it is, because what she told me was, I said, if they've got insurance, you pick up the difference. If they don't have insurance, she says, yes, we could help anybody and everybody, but they've got to go through that application process, because I'm sure not everybody can get help due to their lacking this, that, or the other. But she made it seem like it's a free-for-all and they're very open, but I'll find out. But thank you, Rebecca. I appreciate that.
And again, I think that's something that if you really don't think of it, or if you don't have an issue with it personally, you don't think about it. You don't think about an annual hearing screening like you would maybe, for vision or your health. I mean, we really need to educate our community that these are the preventive health should be our focus. So I think this would be a great opportunity for that.
Yeah, I agree. Thank you.
Diana, thank you for the input. Thank you for the information. And Erica, you're always welcome to join and share whatever knowledge and your ideas you have. No problem. Okay,
Thank you.
So
I get excited.
I don't take offense.
Let's do this and let's do that.
No problem whatsoever. You make my job easier. So no, thank you all.
Thank you.
So does anyone have anything else to say? Marta, I want to congratulate you on your child. No ha dicho ni una palabra. Okay. Lo tienes bien controlado, okay?
No, and this is, I have his cartoon on. My other twin is just awake. He was supposed to fall asleep and he didn't. The other twin did. So that's what I mean with the schedule. So then one is gonna be awake and then the other one's gonna be asleep, but we're good. We just take it day by day. But I was on mute. That's why you didn't hear.
Oh, that's the reason. I was like, wow.
You didn't hear the racket.
Okay. Sounds good.
No, it's fine. It's always, this is how we're living right now. So it's great to see another little baby face on the screen, because I've had to do that for a couple of meetings as well. So I know how it is, but this is the life they're for them. It's normal, so they know what the screen means. They know what the videoing and using this technology now. So this is going to be normal for them.
Yeah.
Hopefully this is the first and last time that we'll have to do this after this pandemic gets under control.
Yeah, hopefully.
Okay, so if there are no other agenda items or ideas that you all would like to share.
Just everybody be safe and Merry Christmas, and just watch out for yourself and your loved ones, okay?
Yes, absolutely.
Likewise. Merry Christmas. Happy
Thank you,
holidays,
Dawn.
everybody.
Thank
Merry
you.
Christmas. Happy holidays.
Thank you. Can I get somebody to motion to adjourn?
I'll motion.
Thank you.
I'll second.
Thank you all. Have a safe Christmas, New Year's.
Thank you.
See
Happy
you all in
holidays, everyone.